Prometric QA and Rational 61-120. Part 2. 81. The registered nurse is making assignments for the day. Which client should be assigned to the pregnant nurse? A. The client with HIV. B. The client with a radium implant for cervical cancer. C. The client with RSV, respiratory syncytial virus. D. The client with cytomegalovirus. 81. Answer is A. The pregnant nurse can care for the client with HIV if she uses standard precautions. The clients in answers B, C, and D pose a risk to the pregnant nurse. 82. The nurse is planning room assignments for the day. Which client should be assigned to a private room if only one is available? A. The client with methicillin-resistant Staphylococcus aureus, MRSA. B. The client with diabetes. C. The client with pancreatitis. D. The client with Addison's disease. 82. Answer is A. The client with MRSA is placed on contact precautions. The clients in answers B, C, and D pose no risk to themselves or others. 83. The doctor accidentally cuts the bowel during surgery. As a result of this action, the client develops an infection and suffers brain damage. The doctor can be charged with A. Negligence. B. A tort. C. Assault. D. Malpractice. 83. Answer is D. The doctor could be charged with malpractice, which is failing to perform or performing an act that causes harm to the client. Answers A, B, and C are incorrect because they apply to other wrongful acts. Negligence is failing to perform care for the client, a tort is a wrongful act committed on the client or their belongings, and assault is a violent physical or verbal attack. 84. Which assignment should not be performed by the nursing assistant? A. Feeding the client. B. Bathing the client. C. Obtaining a stool. D. Administering a fleet enema. 84. Answer is D. The nursing assistant should not be assigned to administer a fleet's enema. They can administer a soap suds or tap water enema. The other tasks can be performed by the nursing assistant, therefore, A, B, and C are incorrect. 85. The mother calls the clinic to report that her newborn has a rash on his forehead and face. Which action is most appropriate? A. Tell the mother to wash the face with soap and apply powder. B. Tell her that 30% of newborns have a rash that will go away by 1 month of life. C. Report the rash to the doctor immediately. D. Ask the mother if anyone else in the family has had a rash in the last 6 months. 85. Answer is B. The mother is most likely describing a newborn rash. About 30% of all newborns have a rash on the face and forehead that dissipates in approximately 1 month. A, C, and D are incorrect actions. 86. Which nurse should not be assigned to care for the client with a radium implant for vaginal cancer? A. The LPN who is 6 months postpartum. B. The RN who is pregnant. C. The RN who is allergic to iodine. D. The RN with a 3-year-old at home. 86. Answer is B. The nurse who is pregnant should not be assigned to the client with a radium implant. The other nurses are not at risk when caring for this client, so A, C, and D are incorrect. 88. The nurse is suspected of charting medication administration that he did not give. After talking to the nurse, the charge nurse should A. Call the board of nursing. B. File a formal reprimand. C. Terminate the nurse. D. Charge the nurse with a tort. 88. Answer is B. The next action after discussing the problem with the nurse is to document the incident by filing a formal reprimand. If the behavior continues or if harm has resulted to the client, the nurse may be terminated and reported to the board of nursing, but these are not the first actions requested in the STEM. A tort is a wrongful act to the client or his belongings and is not indicated in this instance. Therefore, answers A, C, and D are incorrect. 89. The home health nurse is planning for the day's visits. Which client should be seen first? A. The 78-year-old who had a gastrectomy 3 weeks ago and has a PEG tube. B. The 5-month-old discharged 1 week ago with pneumonia who is being treated with amoxicillin liquid suspension. C. The 50-year-old with MRSA being treated with vancomycin via a PICC line. D. The 30-year-old with an exacerbation of multiple sclerosis being treated with cortisone via a centrally placed venous catheter. 89. Answer is D. The client at highest risk for complications is the client with multiple sclerosis who is being treated with cortisone via the central line. The clients in answers A, B, and C are more stable and can be seen later. 90. The emergency room is flooded with clients injured in a tornado. Which clients can be assigned to share a room in the emergency department during the disaster? A client having auditory hallucinations and a client with ulcerative colitis. B. The client who is pregnant and a client with a broken arm. C. A child who is cyanotic with severe dyspnea and a client with a frontal head injury. D. The client who arrives with a large puncture wound to the abdomen and a client with chest pain. 90. Answer is B. The pregnant client and a client with a broken arm are the best choices for placing in the same room. The clients in answers A, C, and D need to be placed in separate rooms due to the serious natures of their injuries. 91. Before administering eardrops to a toddler, the nurse should recognize that it is essential to consider which of the following? A. The age of the child. B. The child's weight. C. The developmental level of the child. D. The IQ of the child. 91. Answer is A. Before instilling the eardrops, the nurse should consider the age of the child because the ear should be pulled down and out to best deliver the drops in the ear canal. Answers B, C, and D are not considerations when instilling eardrops in a small child. 92. The nurse is discussing meal planning with the mother of a 2-year-old. Which of the following statements, if made by the mother, would require a need for further instruction? A. It is okay to give my child white grape juice for breakfast. B. My child can have a grilled cheese sandwich for lunch. C. We are going on a camping trip this weekend, and I have bought hot dogs to grill for his lunch. D. For a snack, my child can have ice cream. 92. Answer is C. Remember the ABCs, airway, breathing, circulation, when answering this question. Answer C, because a hot dog is the size and shape of the child's trachea and poses a risk of aspiration. Answers A, B, and D are incorrect because white grape juice, a grilled cheese sandwich, and ice cream do not pose a risk of aspiration for a child. 93. A client with AIDS has a viral load of 200 copies per ml. The nurse should interpret this finding as A. The client is at risk for opportunistic diseases. B. The client is no longer communicable. C. The client's viral load is extremely low so he is relatively free of circulating virus. D. The client's T-cell count is extremely low. 93. Answer is C. A viral load of 200 is extremely low. This indicates that the client has a low risk for opportunistic illnesses. A, B, and D do not indicate understanding. 94. The client has an order for sliding scale insulin at 1900 hours and Lantus insulin at the same hour. The nurse should A. Administer the 2 medications together. B. Administer the medications in 2 injections. C. Draw up the Lantus insulin and then the regular insulin and administer them together. D. Contact the doctor because these medications should not be given to the same client. 94. Answer is B. Lantus insulin cannot be mixed with other insulins, but can be taken by the client taking regular insulin. A, C, and D are not correct methods of administering Lantus insulin with regular insulin. 95. A priority nursing diagnosis for a child being admitted from surgery following a tonsillectomy is A. Altered nutrition. B. Impaired communication. C. Risk for injury/aspiration. D. Altered urinary elimination. 95. Answer is C. Always remember your ABCs, airway, breathing, circulation, when selecting an answer. A, B, and D are incorrect because they are not the priority. 96. What would the nurse expect the admitting assessment to reveal in a client with glomerulonephritis? A. Hypertension. B. Lassitude. C. Fatigue. D. Vomiting and diarrhea. 96. Answer is A. The client with glomerulonephritis will probably have hypertension. B and C are vague answers and are therefore incorrect. D does not directly relate to glomerulonephritis. 97. Which action is contraindicated in the client with epiglottis? A. Ambulation. B. Oral airway assessment using a tongue blade. C. Placing a blood pressure cuff on the arm. D. Checking the deep tendon reflexes. 97. Answer is B. A child with epiglottis has the possibility of complete obstruction of the airway. For this reason, the nurse should not evaluate the airway using a tongue blade. A, C, and D are allowed actions and are therefore incorrect. 98. A 25-year-old client with a goiter is admitted to the unit. What would the nurse expect the admitting assessment to reveal? A. Slow pulse. B. Anorexia. C. Bulging eyes. D. Weight gain. 98. Answer is C. Exophthalmos, protrusion of eyeballs, often occurs with hyperthyroidism. The client with hyperthyroidism will often exhibit tachycardia, increased appetite, and weight loss. Therefore, answers A, B, and D are incorrect. 99. Which of the following foods, if selected by the mother with a child with celiac, would indicate her understanding of the dietary instructions? A. Whole wheat toast. B. Angel hair pasta. C. Reuben on rye. D. Rice cereal. 99. Answer is D. The child with celiac disease should be on a gluten-free diet. Answers A, B, and C all contain gluten, while answer D gives the only choice of foods that does not contain gluten. 100. The first action that the nurse should take if she finds the client has an O2 saturation of 68% is A. Elevate the head. B. Recheck the O2 saturation in 30 minutes. C. Apply oxygen by mask. D. Assess the heart rate. 100. Answer is C. Remember the ABCs, airway, breathing, circulation, when answering this question. Before notifying the physician or assessing the pulse, oxygen should be applied to increase the oxygen saturation, so answers A and D are incorrect. The normal oxygen saturation is 92% to 100%, making answer B incorrect.